Gerald, I can see that you've got a smartwatch on there. I've got one. I don't happen to be wearing. Oh, you've got two. I don't happen to be wearing it today. You know, there are all these different sorts of things. There's the, you know, there's a variety of different sensors in our smartphones. They're sort of everywhere right now. You can think about interstitial sensors in a continuous glucose monitor. You know, how do we get this right? How do we get this sort of opportunity to completely redefine how we define health and how we define sort of a medical condition? How do we get it right? It's starting with what's important to the patient. It's starting with what's clinically relevant. It's starting with the information that the treating provider needs or that the researcher needs in order to make a decision. It's not starting with, I was at a trade show and got a really good deal on 250 Apple Watches. And it's certainly not, well, we've got these technologies that were returned from another trial. They're already at the sites. Let's just whack them in the next study. You know, that would be ops first. You know, buying the shiny gadget at a trade show is the tech first. We really need to think about, what are we trying to measure? What is interesting about the patient's lived experience of their condition and what they're experiencing? And then how do we actually extract from that? Because now with technology, there's myriad ways to do it. Think of something even as what sounds simple as sleep. Well, what aspect of sleep are you most interested in, right? You interested in sort of quality? Are you interested in duration? And even once you've made that decision, there's many, many ways to measure each of those. What are you trying to measure and why?